Well, good morning, everybody. I'm Bryan Andregg. I'm a Carolina Health Informatics Master's candidate, and I'll be presenting on my topic, which is supporting essential public health services with research publication informatics. I'm going to put my slides into presentation mode, which means I probably won't see if you got your hand up if you're asking a question. So just interrupt me. I'll try to leave time. We'll probably leave time for people to ask questions, or you can just hold them to the end and we'll come back to it. So with that, let me take this away. All right, so as I said, my topic is supporting essential public health services with research publication informatics. This topic actually came from a question I was asked 5 or 6 years ago by our dean at the time, Barbara Reimer, and our associate dean for research, Penny Gordon-Larson, who asked what we all thought was a great question: how much research do we do about social determinants of health in public health? How much of our research is about health inequity? It turned out that's a much harder question to answer than we had anticipated 5 years ago. As a reminder, if you don't know, in Zoom, on the client end, you can all control your view size of what I'm showing on the screen. So you just hover over the center viewing screen thing, and you can pick the size of the window you see, and you can scroll around. So if my slides get really dense, you can zoom them yourself to see what we're looking at. So as background, the Public Health National Center for Innovations defines 10 essential public health services. These are things we hope that public health schools, public health departments, at the federal level, the CDC and the FDA are all promoting to build an environment, a culture of public health across the United States. So in these, you can see they range from actual practice of public health to policy development. So there are 2 of these public health essential services that really jump out as being frameable in the question: how much research do we do about health inequity? And in support of the public health services, that's policy development. How do we communicate effectively to the public, to legislatures, to the federal government about the research we're doing so that they can use that research and make it effective in their practice? And then the second one, and this is near and dear to my heart and my internship advisor Dacia's heart at the School of Public Health, is assurance, and building a diverse and skilled workforce. And so we build a workforce by attracting people to our research, to our practice, to our researchers, to come want to be public health practitioners. So, how do we do that? Well, the original question was, how do we tell the public and legislatures and everyone about the great work we're doing in social determinants of health, health disparity, health equity, so that the legislature looks favorably at us with funding, the CDC looks favorably at us with funding, the public actually take advantage of our practice, and we attract students to build that workforce in an ongoing way. So, the way you would think you gather this information is, first you find all your publications, then you review the obvious places where topics stand out, and then you report out about it. So the first thing you've got to do is build the publications, and the place to go for publications in the public health world is the 900-pound gorilla in the academic publication space, Elsevier. Elsevier is the single best source of peer-reviewed publications in public health. It's not the only source, but it is far and away the best source. Where we can identify that things are missing, we can talk about that. But the majority of our researchers are publishing in places that are ingested by Elsevier. And Elsevier isn't a great search engine unless you are a trained librarian and really know how to use their search index. It's also not available unless you are at an institution that has a license with Elsevier to access the deep behind scenes part of their database. They make a small amount of information available to the public, but it's certainly not everything we would want to tell the public about our work. What they do provide is an API. So they have a REST web instance that you can query to find information about your researchers and your publications. Again, if you're at an institution that has a license with Elsevier, which we do. And so the first thing we did was we started gathering our publications. This is where that Zoom feature may come in handy. I just got a brand new 4K 27-inch monitor. So this looks great on my screen. So the first thing we have to do is we have to find our authors. Thankfully, I work with some very sharp people in our strategic analysis and business intelligence group who tell us who the Gilling's primary faculty for a given year or term are. Then we use the Scopus API to take those names, the Elsevier affiliation IDs for UNC Chapel Hill, of which there are 5 or 6 that really relate to us. And we have an automated loop that runs through the Scopus API and it queries authors by affiliation ID and last name. And then we use the author's first name to verify the match. We actually use 2 authors' first names because we have some cleverly named people like our chair of epidemiology, Till Sturmer, who has an umlaut in his name, which doesn't always show up in the database the way one might expect. So we also use UNC's LDAP directory system to get the preferred name. So if we can match first name, last name, and affiliation ID, we call that great. We know that that is the right person for us. Unfortunately, we can't always match that because Elsevier's data gathering process doesn't exactly manage when people move between institutions like Duke and UNC, or when people start their publication history and they're working for a local health department. So they may not always match this easily. So then we enter a manual loop, and there's a complex set of Python functions that I wrote to support this with Oracle and JSON, using PyCharm, which is an IDE by JetBrains, which is really terrific, and I highly recommend it. So going into a manual loop, I have developed a Jupyter notebook that allows me then to say, I didn't find affiliation first name, last name. Let's just try affiliation last name. And then can I go through the list of results and find the right person? Always aiming to find what in Scopus is considered the author ID. And as you can see, we kind of walk through the manual loop, getting less and less and less refined until we decide we've found our authors or not. So once we've found all the authors, and this is a process that has to be repeated on an annual basis for the minor changes to our faculty population. Then we have to go find our publications. And so again, I built a set of Jupyter notebooks and automated routines that use those Scopus author IDs and queries their API to pull in publication information. So the first time this runs, it took probably about 6 hours to pull in all of the publication information for all of our authors we want. We refresh this on a weekly basis, and we do that to account for a couple of things. We have new publications always being added to our authors as Elsevier's background process works. Publications have updated citation counts we want to account for. And so we run this then on a weekly basis. And on a weekly basis, this takes about 15 or 20 minutes to actually run through everything. And it runs from an automated job on one of our database servers and then stores the results in our Oracle database for consumption we'll talk about in a moment. Then, of course, we've got to keep this whole thing up to date. As I said, Elsevier is kind of a black box as far as Scopus is concerned. And so sometimes their black box realizes they have multiple author IDs for the same person. Our current interim chair or department dean for research, Andy Olshan, has 3 Scopus IDs. One of them has 497 publications. The other 2 each have like 1 publication. But at some point, Scopus will realize that and they'll collapse those together. And so one of your author IDs will just disappear from the API. Occasionally, they'll realize that they've misassigned a publication. It turns out there are a lot of John Smiths in the world and a lot of John Smiths that published. And so sometimes they'll mistakenly associate a publication with the wrong John Smith, even if they're both at UNC. And someone will put in a request to change that. And so your publication database and the API will have a mismatch for document count. So on a weekly basis, we run a cleanup process that after the fact on a monthly basis takes me about 5 minutes to kind of straighten everything out using this in-depth set of scripts and functions and Jupyter notebooks to amend kind of our data set to be as clean as it can be. All of which is to say, I don't think it's ever going to be 100% clean. I think it's going to be as accurate as we can make it. So what this then produced as far as publication informatics at the database level is the set of tables and views which really tell us about our primary faculty and their Elsevier research publication footprint. We also included in here the ability to do some fuzzy matching on topics based on a scoring algorithm that compares topics. Researchers like me, not great spellers all the time. And so misspellings or alternative spellings of topics and terms sometimes come in here. And so we have a way of accounting for if topics are 90% alike or better, we can search for that. And so let's take us back to kind of the original question, which it turns out is really challenging. Even with this giant database, from 2017 onward, that's about 7,800 publications. The obvious places to look for terms like health and equity, social determinants of health, are in 2 places. They're either in PubMed under what are called mesh terms, and mesh terms are human-assigned terms associated with publications that have a very strict vernacular and taxonomy, very useful, and author-assigned keywords. Unfortunately, these topics are pretty new, and so health disparity, minority and vulnerable populations, that was only added as a mesh term in 2022. So we don't know anything about the publications that predate that term. Social determinants of health was added in 2014. But we've had researchers who were doing that work since before then. And a topic like gender equity, that was only added 2 years ago. So we can't really use mesh terms and these author keywords as a way to simplify our search. Worse is their actual distribution across the papers. If you look at the author provided keywords in the last five plus years, our authors have used over 13,000 keywords. And the median use is 1. And so that there's just not a lot of commonality there. And I will tell you from experience working with our researchers, in a department like health equity or health behavior, they actually use different terms. Cancer prevention or smoking cessation and tobacco use are used by different researchers to mean the same thing, and they prefer their terms. Even the PubMed mesh terms, which have that strict taxonomy I talked about, in the last 5 years, there are 5,000 of them. The most popular one out of these 7,800 publications, by the way, is human, which ranks in at about 6,800 publications. That's not particularly useful. followed by female, followed by male. And then within about 50 terms, you've fallen off into counts of tens. So not a good place to look for these terms. So then we thought we'd try applying some machine learning techniques to find meaning in our publications. Maybe we can at least find out what are we researching so we can tell the public and legislators about it. So we approached this by going through a machine learning data cleaning process where we take the abstracts of publications. These are the biggest bundles of words that come with any of our publications. We take abstracts and titles, and we want to match them. And so we need to do some things. First thing we need to do is we need to clean the data set. So we get rid of all the standalone numbers. So not COVID-19, but where the number 3 shows up, unrelated to anything else. We remove words that are shorter than 3 characters. We change all the characters to lowercase. We remove all stop words. Stop words are commonly used English words, and, the, a, there. And then we have to remove another set of words, because in research, there are really common stop words, like correlation interval is one of the most common terms, because everyone puts it in their abstract to demonstrate that their research is good. And then we run this through a topic frequency inverse document frequency algorithm to get us what are called features, right? So this results in about 3,500 features. Features are just words. But if you look at 3,000 abstracts by 3,500 features, you can imagine the size of the matrix calculation that we're doing behind the scenes to generate this. Using a combination of Jupyter, scikit-learn, and several other informatics packages. And it just didn't work. That's the really sad thing to say. So we use 2 techniques. They're both our matrix-based distance measuring techniques. The first is called k-means clustering, where you define a number of clusters you want to search for, and then you see how near or far abstracts are to each of these clusters, and you report out. And if you zoom in on the right corner, that red line that curves down nicely, if you've got a good data set for k-means clustering, you can use that smooth curve to find kind of the right spot where the number of clusters stops adding more value and is really well defined. If you look at the jagged blue line, which is the scoring of clusters between 1 and 100, there's no curve, right? There's no place to pick to say this is the right number of clusters. So then the next thing we tried was a technique called latent Dirichlet allocation, which is a topic finding algorithm. You can see its model output in the lower right-hand corner. And you can see there are definitely topics that rise to appearing valuable. And so cancer at topic 14, women at topic 18, genetic at topic 20. But there are real problems here. Very few of these topics demonstrate coherence. And really, to make value of this, you need a professional full-time data scientist, of which I am not a professional full-time data scientist. And so I could tune this to a certain point, but just like k-means, you're always trying to predict the number of topics that's right. And it just wasn't successful. It certainly didn't get us anywhere near answering our question, how much research do we do in social inequity? But this actually really makes a lot of sense when you're talking about research publications, because the academic publishing world favors specificity. It favors uniqueness, and it's really hard to cluster when every researcher has had to develop their own unique workspace in a field like public health to differentiate themselves in order to get their PhD, in order to get tenure. They have to find the topic that matters to them, which means they're not a lot like everyone else. Maybe inside of a department, but even then, It's very tough across the school. If you look at Gillings, our research breadth is very wide. We're biostatistics to public health leadership, which is all about practice. So pure academic to pure practice. Our departments specialize, our faculty specialize, our students specialize. So unsupervised machine learning, which is what those two techniques were, just doesn't work. But it's possible there's a more naive approach that does work and at least can tell us what we do. And so we can count what are called engrams. These are 2 or 3 word phrases that appear with popularity in our publication set. And so this is a look at our Department of Epidemiology. And you can see this rapidly tells you exactly what our Department of Epidemiology studies. They study breast cancer. They study breast cancer in North Carolina for young women in Hispanic and Latino populations. They spent a lot of time over the last few years studying SARS-CoV, not surprisingly. So now we're getting to use these informatics processes to tell us what we do, and then we can start to look for our appropriate phrases like social determinants of health or health inequity in here, or we can take this model straight to the public, straight to prospective students, straight to our legislative bodies and say, we're doing a ton of work on breast cancer in North Carolina. We think you should support that work, and we want to encourage more people to go into that work, thus supporting 2 of those essential services of public health. But even this doesn't work for everybody. So here's a department. It looks like they do the vast majority of their work in the Hispanic or Latino community. It looks like they do work in a lot of other places as well. And this is biostatistics. And biostatistics as a department presents its own unique problem area when trying to tell what kind of work they do, because they do this much work, my hands are very wide apart, where they are the collaborators on research. They are the statisticians on a paper, and the papers are about all kinds of different topics. And that's great, but within biostatistics, that's not what they think of as the important work. They do this much work developing new methods. And new methods are for them the really important work, because that's what lends itself to dissertation acceptance, to tenure, to publication, all of which is what creates an attraction for incoming students of public health, all of which helps us promote to our public the work we do. But engrams doesn't work for them. So then we went back to the drawing board and we said, you know what, I don't know that us trying to tell people what they study is the right approach. Let's enable them to do this on their own. So the informatics that go into supporting the publications database is the value proposition for the school and for our scaffolding support of public health informatics. And so how do we do that? What do we build to support all that? And so behind that publications database, the informatics, there's 12 Scopus API finding functions. There are 30 Oracle management functions. There are 10 query functions. It's a little over 1,200 lines of Python, all written in the 400 hours I spent doing this over the last 6 months. And what that lets us then do is ask well-crafted questions. And I posit, how much research do we do in health inequity isn't really a well-crafted question. A well-crafted question, and ones we've been able to answer over the last 6 months, directly look like this. What are the most common engrams in research publications? And can you provide that by department? And can you provide that by researcher? And we can. Can we find research faculty based on a topic? And that topic can be in a title, an abstract, one of those author-supplied keywords. A mesh term is assigned by the National Library of Medicine. And we can. And what that means is that prospective workforce, prospective funders, can find our research by topic. More specifically, can you tell us how many unique publications we published in 2022? And the answer is 797. And they range from AIDS and Behavior as the top publication with 45 Scopus entries down to publications with just one entry. Does Scopus include everything we're interested in, including our Department of Biostatistics? Yes, it includes their top journals. Questions recently asked in support of some campus-wide efforts to promote translation science in the health affairs space. Can you find all the publications and Gillings authors that are related to brain sciences, searching for cognition, neuroscience, and brain? And then very important for the School of Public Health, and especially in the assurance essential service of public health, which is developing a workforce, can we report to our accrediting body about peer-reviewed publications during our self-study years? And yes, asking a very specific question, how many article type publications do we have entry for July 1, 2020 through to now? We can do that, and we can do that by year. But I decided we weren't really done there. I love this. I love the self-service enablement, and I would love to have just handed off to our research group, to our communications group, to the State Department of Public Health, a big database. But most people don't know SQL. Most people don't know Jupyter. Most people don't know Python. So a big database, not greatly useful. So we made a web API as well, which allows a non-technical audience to self-support using a web browser. So right now, this exists as JSON output only. I have a web developer who is continuing work with me, and he's going to be turning this into a pretty stylized tabular output that we can just display on the Gillings webpage or the North Carolina Public Health Department webpage or any other web page we want. And what this looks like is, can you help me find an author? I'm looking for information about Andy Olshan because I think he's a neat researcher, and I want to see what kind of publications he's doing. And so I have a very simple URL. You can see highlighted at the top in the blue and green, and that gives you back an immediate response. I can search on topics, and I can do that with limitations based on either name or departments, cover dates. And so I can come in here and I can say, tell me about, I'll be honest, I don't even remember what I searched on to generate this topic, but tell me about all the publications that match on any given topic. And so this is an additional about 1,700 lines of Python. It's running in production now. We've got a production web server this is available on. And so anyone can write their own front end and access this information. And the best part is it's self-documenting. And so with this URL, anyone who's interested in writing that nice, pretty table display front end can go to the documentation URL. They can see what kind of options it accepts. They can see what kind of values those options take. They can see what kind of response they would expect to get back. And they can see a list of all the different endpoints, which will allow anyone, including our health sciences library or the Department of Public Health in North Carolina, to access this database without the Elsevier Scopus paywall being a consideration, to query public health research for promotion of policy development, workforce development. And then coming soon, we're going to put this on our website and make it publicly available for everyone to consume and be able to self-service support finding that information about public health, and then allow us as an organization to further those essential services of public health with the best evidence we have. So with that, I'd like to thank my internship mentor, Dezio Limaroas, who is on this Zoom. My chip advisor, Saif Kairat, who I'm not sure if he's here or not. Our research group, which is Alexia Kelly and Andy Olshan, the UNC Health Sciences Library, and then my supporting team, my web developer, Paul Glass-Steele, my DBA, Tim Madden, and then my boss, who has been supportive of my entire chip process, Kathy Anderson. So with that, I'm going to stop my screen sharing so I can see everybody, and I will take any questions that you have.